Have you already been diagnosed with pudendal nerve neuralgia, but your doctor isn't helping you with the treatment? Then stay with this video until the end because that's exactly what we're going to talk about now. When we talk about treatment for pudendal neuralgia, there are two types: conservative treatment, which includes medication and physical therapy, and surgical treatment, which involves nerve blocks and even surgery to decompress the nerve. First of all, the conservative treatment. This is done through the use of medications to improve neuropathic pain, such as pregabalin, gabapentin, and amitriptyline, which are controlled medications and should only be used with a doctor's prescription. In addition, pelvic physiotherapy is essential as it works the pelvic floor muscles and helps to release the area where the nerve is compressed. Finally, avoid the triggering factor. For example, if your symptoms started after you spent a lot of time cycling, riding a motorcycle, or sitting on a hard chair for a long time, avoid these activities or protect the area by using cushions. If you have already changed your habits, no longer sit for long periods, no longer ride a bicycle or motorcycle, have used medication, and even with physiotherapy your symptoms still persist, then we move on to a slightly more invasive treatment. The first possible treatment to be performed is anesthetic nerve blocks. Using ultrasound, we perform an injection around the area of the nerve with anesthetic medication and corticosteroid. These nerve blocks can be performed more than once in a series over several weeks to help release the nerve and desensitize the area where the patient feels pain. If even so the problem is not resolved, there is the nerve decompression procedure, where we make an incision in the gluteal region and decompress the ligaments that are compressing the nerve in that area. So, if you ask whether pudendal nerve neuralgia can be cured, yes, there is treatment. The treatment should initially be started early with a specialist doctor using physical therapy and medications. If that does not resolve the issue, then with an anesthetic block, and finally, surgery. The sooner you seek treatment, the greater your chances of improving your symptoms. Patients who have suffered from very intense pain for many years, even after nerve decompression, may still retain a certain degree of pain. And in these cases, we perform electrode implantation for neurostimulation to achieve a better response to treatment. If you want to know more information about neurostimulation implants for improving neuropathic pain, there are several videos here on the channel. If you enjoyed this and want to learn more about pudendal neurology, like this video and follow our channel.